So hi guys, I wanted to do a vlog on MERS, Middle East Respiratory Syndrome, but I thought it'd be more authentic if I actually came out to the Middle East to do it here where all the action's happening. So I flew out to Dubai, hired a yacht as you can see, and I've come down to Abu Dhabi where I'm just looking at the Abu Dhabi skyline at sunset, and just, you know, all because I'm dedicated to the cause for you guys. So first of all, just to get into MERS. MERS was first identified in September 2012. The same month, the second case was found in a Qatari citizen. The first case was found in Saudi Arabia. And so very soon they realized that MERS could be transmitted internationally through travellers. This phenomenon has since been seen repeatedly, though all known cases of MERS have been linked to exposure to countries in or near the Arabian Peninsula. Now, if you look at the map there, MERS is being diagnosed among travellers in 26 countries, including other parts of the Middle East, Europe, North Africa, Asia and North America, and there have been a significant number of cases in South Korea in 2015. So what I want to do now is just go through the 5 T's of MERS, as you will have seen from last week's vlog showing how the 5 T's framework works. So first of all, we start straight in with T is for type, and MERS is caused by a newly recognized coronavirus. There are 6 strains of coronavirus which affect humans. MERS represents a second coronavirus that caused major global concerns in the last 10 years. Obviously, the first one was SARS in 2003. It produced a transcontinental outbreak that resulted in over 8,000 illnesses, and it had a case fatality ratio of 9.6% before ending later that year. So type of disease, MERS is an acute respiratory illness. It causes fever, cough, shortness of breath, some cases diarrhea and vomiting. Pneumonia is also a common complication, and other complications include other respiratory, cardiac and renal. And it has a whopping 40% case fatality ratio. But where did it suddenly come from? So the next T is for transmission route, and at the moment it's not really very well understood. It's genetically similar to bat coronavirus, so it's possible that, like many other diseases in humans, it could have originated in bats. But interestingly enough, studies have shown that antibodies in camels are identical to those found in humans. So it's possible that camel-to-human contact is where it came from. And some people who later developed MERS had exposure to camels that had detectable MERS virus, which suggests that camels may play a role in spreading the virus or may even be an animal reservoir. Evidence suggests person-to-person, close contact, families and healthcare settings, but there's no concrete evidence as to how it's transmitted from person to person or how it's maybe transmitted from animals to people as well. And the next T is for treatment, and this is quite an easy one because there is no treatment as it's a viral disease and there is no vaccine for it. The next T stands for traveller's risk, and looking into the transmission route, it seems to be very similar to TB in how easy it is to contract. Generally, you know, very close person-to-person contact, so not generally a very easy illness to pass on. It's generally very low risk for travellers, and incidentally, few infections have been found in children. The WHO say that the high-risk groups include diabetics, those with renal failure, those with chronic lung disease, and those who are immunosuppressed. Healthcare workers are obviously at significantly increased risks, so, you know, bear in mind those going to work for the tax-free money in Saudi Arabia. Nurses, etc., maybe want to be aware that this is a significant risk for them. So the advice to travellers really is avoid close contact with people suffering from respiratory infections, hygiene precautions including hand washing, don't touch eyes or mouth, avoiding close contact with live farm or wild animals, particularly camels. Food from animals should be thoroughly cooked or pasteurised. Again, they're not sure if that's a transmission route, but it's just being cautious there. And travellers returning from the Middle East or Korea who develop a significant respiratory illness with a fever and cough should seek medical advice. So the final T is for take-home message, where we make a summary for our travellers. So it's a viral disease causing severe respiratory illness with a 40% case fatality ratio. It's passed on by close person-to-person contact and possibly contact with animals. There's no treatment and no vaccine, and it's generally low risk, although certain coexisting illnesses are risk factors. Hand hygiene, mouth, eyes, avoiding contact with sick people and animals, particularly camels, and if you're sick, seek medical advice. healthcare workers and visiting friends and relatives are at increased risk. And further information can be found at NATHNAC, Fit for Travel, the Health Protection Surveillance Centre in Ireland, and of course the CDC in the United States. Thanks very much for listening. If you found anything to be inaccurate or misleading, then please let us know, because that's what we're here to do, create discussion. You can comment on the YouTube channel, or you can comment on the Facebook page, and we'd like to hear from you. So thanks very much, and I'm off for a swim.